The hospitalist is a trained physician that is there to take care of patients in the hospital. That's what we specialize in. We're not the primary care physician. We do not have offices out in the outpatient setting, but we're the ones that will take care of you while you're in the hospital. Now, our other role, however, is to help with process improvement to improve the quality of a patient's hospital stay, improve the timeliness of getting test results, of getting information even back to the primary care physician so that they know how and why the patient was admitted, to help them take care of the patient after someone is dismissed. We're trying to build value into the system by providing this kind of care 24 hours, 7 days a week. This is available to this hospital, this community, where in many of our other hospital systems, they may not have 24-hour care. So this is an additional benefit to this community. Not only do they see typically the emergency room physician, but shortly thereafter they will see the night shift hospitalist. So we get a second set of eyes on that patient, identifying, confirming perhaps what's going on, getting the orders into the for the patient so that treatment can be initiated in a timely manner. If a patient that's already admitted, if they decompensate, there's a physician that's in-house and available for the staff to call and to get assistance. Typically, hospitalists are family practice or internal medicine trained. They go through their years of residency for that. Lately or recently, there have been fellowship programs for hospital medicine hospitalists, giving additional training and education that specifically address patients that are hospitalized. Recently, our group has had the addition of 6 nurse practitioners that assist the hospitalists in providing care for the hospitalized patients here at Genesis. The roles and duties of the nurse practitioners will change depending on what role they're playing that particular day. But the important thing is that all of the nurse practitioners will always be under the supervision of a hospitalist. After a patient is discharged from the hospital, the hospitalist will provide a discharge summary. This discharge summary highlights why the patient came in, what treatments were provided, test results, and then a plan of care after they leave the hospital. This information is then sent back to the primary care physician so that everybody's on the same page and care is optimized. Communication between the primary care physician and the hospitalist is typically always present. When a patient first is admitted, the emergency room will notify the primary care physician. During the hospital stay, depending on the situation, the hospitalist may end up calling for information from the primary care physician. Things such as any change in medicines, change in care, any family issues that may be present that might give the hospitalist a better understanding of what might be going on with that patient at that time. Ideally, our group tries to have the same hospitalist see the patient throughout the entire course of that stay. Unfortunately, doctors have rotations of days that they work, so there might be a change of guard, if you will, where that patient may see a second hospitalist. Or if there's an emergency, the hospitalist may not make it to work that day. So a stand-in may come in and help out. But the goal is to have the same doc see the patient. What do I like best about being a hospitalist? When that patient, after you see them and take time in detailing why they had the illness, what to expect of their illness, and the improvement that they have had, they look back at you and say, thank you for taking the time and explaining.